trauma. If it's a blunt trauma, definitely there is some swelling which is going to appear. You can keep ice pack to reduce this reaction. Never try to rub. Rubbing will cause tissue injury, and it is going to probably cause more injury than the primary trauma itself. So ice packs allowed for blunt trauma, nothing more than that. If it's a laceration, if there is a wound, wash with soap and water, keep it clean, and if there is bleeding, apply pressure to control bleeds. Even if it's a little bit profuse bleeding, don't worry, keep on applying pressure and take the person towards a medical facility. If you have a knocked off tooth, the same principle apply. To control the bleeding, apply pressure. For applying pressure, what you do is give a clean cloth to bite, and the tooth should be taken as clean as possible to a dentist to see whether something can be done. If you have a broken or dislocated bone, don't fiddle with it, just immobilize that area and get immediate medical attention. So now if you have a nosebleed, keep the head a little bit forward so that whatever bleeds occur is going outwards. And if you hold the head backwards, there is a risk of aspiration of the blood which is flowing in. The nasal areas of like tremendous blood supply, and the bleeding is definitely going to be a little bit profuse and scary. So what you do is prevent aspiration and pinch the nose. Same principle, apply pressure to reduce the bleeds. Pinch the nose tightly, breathe through the mouth, and prevent aspiration. The maximum you can do at home as treatment apart from first aid is giving paracetamol for pain relief. Anything more than that, get a medical opinion. Another common injury, especially in infants, is concussion injury of the brain. Trauma to the brain, they fall, they hit their head. For bigger children, bigger people, the symptoms are slurred speech, weakness, numbness over an area, disorientation, severe headache, nausea, vomiting, convulsions, excessive sleepiness, agitation, loss of consciousness. And if you examine, you may see the pupil of one eye is larger than the other. These are all features of bleed into the head, brain, and features of increased intracranial pressure. In infants and toddlers, it may not be so pronounced because the sutures are not fused, the fontanelles are open, so the features of increased intracranial pressure may not be very evident, but they have incessant cry and refusal to feed. If any of these symptoms are there, definitely get a medical help. Happy parenting.